Hi, this is Dr. Dan Margolin. So I'm a podiatrist in New Jersey. I want to talk to you today. I'm going to give you a very quick summarized course on toenail fungus, the dreaded toenail fungus. So I get so many patients that come in with toenail fungus. Usually it's on the big toes. Usually there's some injury that started it. In other words, they bang their toe. And it's interesting, the toenail itself is there to protect the bone underneath it. It also prevents fungus from really getting into the area unless it's injured. Once the nail itself is injured, it will often trap fungus in there. Now people say to me, where did the fungus come from? I'm not dirty or anything like that. First, there's a couple of things. One, some people are more prone to fungus than other people. It has nothing to do with hygiene or anything like that. Two, fungus is in the environment all over the place, just like bacteria, just like viruses. And when there's a damage to the nail, it can get in and it can spread. Now usually it'll start at the tip or the distal part of the nail and start to go backwards. Here's some common places that you'll find that you get it. Nail salons. Okay? When you go to a nail salon, what you want to make sure they do is autoclave their instruments. A lot of places will do a couple of things. One is they'll use a light. They'll actually put the instruments under a light. Now, from what I see is that light is pretty bogus. It really doesn't sterilize. Another thing they'll use is glutaraldehyde. Glutaraldehyde is like a liquid, and you'll see them put their instruments into a liquid. And actually, if they let the instrument sit in that glutaraldehyde, that liquid, for 24 hours, it would sterilize it. But usually, you know what they do? They take it, they pull it out, they put it back. It goes in for a minute or two. It's not really enough to sterilize the instrument. So what you want to do is really go to a place that puts it in an oven called an autoclave. Okay, so now let's jump into the treatment options for fungus. Now, we wrote these up for our patients, and this is what I'm going to review. It's a sheet on fungal nails. If you would like this sheet or you have questions, you can call us at 201-261-9445, or you can shoot me an email at reception. Well, what is it? Reception at New Jersey Foot?
njfootpain.com.
Reception at njfootpain.com, and just request it and I'll get it out to you. But here's some options for treating foot fungus, and this again goes over a little bit about what foot fungus is. The first option is do nothing. Okay, you don't necessarily have to treat foot fungus. Now, a lot of people ask me, well, could you die from it or could it get into your circulation? It's very rare that a fungus of the toenails is going to do anything but spread to the other toenails. So if we're talking about fungus in the nails, it doesn't necessarily have to be treated, though it can become a cosmetic problem, right? You certainly don't want to walk around with all your nails fungal. Now, the skin, we're not going to go into that so much today. I'll probably do it on another video, but that's called athlete's foot. So that's a little bit easier to treat. The problem again with the nail is when a fungus gets into it, it's very difficult to get medications in it. All right, so treatment one potentially is don't do anything. Two are topical medications. Topical meaning things you would put on the nail. Okay. Now I want to show you a few of these. One you've probably seen in commercials for Jublia, right? This is the prescription one, relatively expensive. It probably runs $500 or $600 a bottle. You have other ones like Formula 3. Also like you apply this topically. Usually you do it once or twice a day. We've come out, actually I've had a hand in putting this together. This is Dr. Toes, and it's really based on an old remedy. Okay, what they found is nano silver particles are antibacterial. They kill bacteria, they kill fungus, they kill viruses. Now I'm telling you this, it's not FDA approved, but this is really what we see for more the holistic medicine types. So what we did is we took nano silver, we took hydrogen peroxide, and we put it into a topical. We've also taken the same concept and put it into a spray form that can be sprayed in the shoes to sterilize the shoes, because when your feet get sweaty and you go put them in the shoes, it actually sets up an environment that fungus can live. And so if we're killing the fungus from your nails, the worst thing you want to do is then put them into shoes where that fungus can be. So we have these two line of products from Dr. Toes. One is a spray for the shoes, one is the topical, and one is also going to be a spray for the toes as well. So anyway, going back to our treatment regime, one is do nothing, two are the topicals. Now, The third option is actually an oral medicine. There's one of them is called Lamisil. You take it once a day for about 3 months. The biggest side effect to that is possibly liver problems. So we do have to do a baseline liver enzyme profile. Usually what we do is we get a baseline. In other words, before you start the medicine, we find out what your liver profile is. We find out how your liver's doing. As long as that's okay, we start you on the Lamisil one a day for 30 days. At 30 days, we get another liver enzyme profile just to make sure the medicine hasn't increased the liver enzymes. And we do that a third time, a month following that. So usually you'll see results around 4 months. All of these things, even the topicals, when you apply the Dr. Toes and all that, you start to see results at about 4 months, because what happens is as the fungus grows out, you'll start to see a line of demarcation in the back. Okay, and a nail itself takes about 9 months to grow from the back forward. So we're looking at about 4 months, you don't really see anything, and all of a sudden you'll start to see a clear line, and it should start to grow out. Same with the oral medicine. Again, the oral medicine, the only concern really is the liver. You can't really drink alcohol or anything like that while you're on it. You have to be careful with that. The next option is surgical removal of the nail. Now, a lot of times we'll see people come in with extremely thickened nails that have been there, 10 years, 15 years. Sometimes those nails don't respond completely to either the topicals or the medication, and sometimes we do remove the nail, not permanently, just remove all the fungal aspect of it. And then as the new nail comes in, here's the trick. Once you've cleaned it, you clean it up, at about 2 weeks post-operatively, is you have the person use a topical antifungal cream, like a Lamisil cream or a Naftin cream, on a Band-Aid on top of it. You can also use like the Dr. Toes, but what you want is as the nail grows out, you want it to grow into an antifungal environment, and that's the trick. It's the same trick. If, God forbid, you ever injure your toe and lose a nail, what you want to do is once you've made sure it's clean, you put Neosporin or bacitracin, these are antibacterials on the nail for a week or two, make sure there's no bacteria. Then, as the nail starts to come in, we're concerned about fungus, then start using an antifungal cream. Naftin, Lamisil are just some examples of that. So let's go back through this again. 1 option, do nothing. 2, topical. 3, oral medicine. And 4, surgery. The last one is something I'm sure you've all heard about, and it is laser. Now, we've been doing laser, I'll tell you how long. We've been doing laser, I think probably about 8 or 9 years. We were one of the first in the state to use it, and the reason was we had a young lady who we had put on Lamisil, and what happened was her liver enzymes went through the roof. And thank God she was okay, but it sort of freaked me out a little bit. I said, there's got to be other options. And we started researching what those were, and the laser came out. And now we've gone through several different lasers to try to get ones that are more effective than other ones. And here's roughly our own sort of in-house study, and just to give you an idea how effective the lasers are. What we found, and again, this is all written out on this sheet, is if you have a fungus less than 2 years, the lasers are pretty close to 80% effective. If you have a fungus greater between 2 and 6 years, the effectiveness of the laser drops. It's about 70% effective, and you have to hit it multiple times, right? You don't just do it once and say, have a nice day. Usually you have to hit it once a month for about 4 or 5 months. And we do, unfortunately it's not covered by insurance, so we do give a guarantee with that as far as reduced cost for coming in multiple times. The other thing is patients that have fungus between 6 and 15 years, the effectiveness drops to about 60%. And after 15 years, if you had a fungus in your nails for more than 15 years, good luck. It is about a 50-50 shot. And that's where we start to then really combine the laser with the oral, with the potentially, like if it's not responding, possibly surgery, and absolutely you start using the topicals and stuff. So I know I gave you a lot of material. I just really wanted to handle a problem that I get a lot of people coming in asking me about. I don't think there's a lot of really good information out there. I wanted to put that out for you. I hope that helps. Again, if you have any questions, you can give us a call. We're in New Jersey, Foot and Ankle Center in Oradell, New Jersey. Our phone number is 201-261-9445. I'm Dr. Dan Margolin, and thank you for watching.